Hello, my name is Dr. Stanley Lang, and the subject of the presentation today is on low glycemic eating in diabetes. Does it really matter? First of all, what is it? So diabetes is, of course, the condition where your blood sugars are too high. We aren't going to get into the exact definitions of that. There are two kinds of diabetes. Type 1, which is where you're insulin deficient. The second is where you're insulin resistant and you've got too much insulin floating around. And we're talking about type 2 diabetes here. So low glycemic means foods that don't raise the blood sugar quickly, and usually is referring to carbohydrates. We're not talking about proteins and fats when we're talking about low glycemic. And the question is, does it really matter? Well, this is an important question because some of the most commonly used diabetic diets still allow high glycemic carbs to be part of the diet. And I have been an adamant proponent of the low glycemic eating for a long time. I'm very much opposed to integrating high glycemic foods into diabetic diets because, in my experience, it makes it impossible for that person to be able to reverse their diabetes. Whereas if somebody follows a low glycemic program, they have a chance to actually reverse their diabetes and at the very least control it without medication, which is a pretty big deal because diabetes is a progressive condition. And one of the worst things that can happen is neuropathy, which is damage to the nerves. And one of the things that I saw today was a patient that is having progressive neuropathy, and he wanted to do something about it. And so we talked very much about him needing to get back on the bandwagon of low glycemic eating because, see, he had previously been successful in reversing his diabetes, and he did this by eating a very low glycemic diet. Well, he'd been feeling so well. He'd been out kind of at his camp for the last few weeks, and his blood sugars had started to creep up because he'd allowed a few high glycemic foods into his diet, namely crackers. Now, he wasn't eating a lot of crackers, but he was eating some. And basically, anything that is made from grains is going to be high glycemic. And so we talked again about how there was no way that he was going to reverse his neuropathy if he didn't normalize his blood sugar. We also talked about some nutritional strategies that would allow him to actually help control his neuropathy. And there are some very powerful nutritional strategies that do help. But it doesn't work if your blood sugars aren't normalized first. So we talked about that, and I want to encourage you that if you have a pre-diabetic state, or you have diabetes, and pre-diabetic state includes any part of metabolic syndrome, you need to be committed to low glycemic eating unless you want the problem to worsen, because it will. So I hope you find this encouragement, though a hard encouragement, I hope you found it as encouraging because there is hope that you can have excellent control of your blood sugars if you just follow a few simple strategies. So I wish you well, God bless, and have a great day.